Thank you, everyone, for joining us this morning for the public briefing to release the new report, Assessing Progress on the Institute of Medicine report, The Future of Nursing. I'm Jennifer Walsh, Senior Media Officer with the National Academies of Sciences, Engineering, and Medicine. For those of you not familiar with the Academies, we are a private nonprofit institution that provides independent, objective analysis and advice to the nation to solve complex problems and also inform public policy decisions related to science, technology, and medicine. The Academies, of which the Institute of Medicine is a part of, operate under an 1863 congressional charter to the National Academy of Sciences, and that charter was signed by President Lincoln. So for each of our requested studies, panel members are chosen for their expertise and experience and serve pro bono to carry out the study statement of task. The reports that result from the study represent the consensus view of the committee and must undergo external peer review before they are released, as did this report. I have with me several members of the committee to discuss the report's findings and conclusions, but before we introduce the committee, I just want to go over a couple of the technical aspects of the webinar. First, the audio for today's event will be streamed through your computer speakers, as you're probably aware. After the opening remarks, we will begin to take questions through the Q&A box located in the lower right-hand corner of your screen. And if you want to ask a question, you just simply type in your question in the box at any time and click Submit. And then we please ask that you leave the box set to send your questions to all panelists. Next, if you have any technical issues during the event, please contact WebEx technical support at 1-866-229-3239. Once again, that number for the technical support is 1-866-229-3239. And also, now that the report is released to the public, you can download a PDF of the report, other resource materials, and the slides from this presentation will be available on this page as well. And the web address is nas.edu/FON5 years. Again, that web address is NAS, as in National Academy of Sciences, .edu/FON5 years. So joining us today are several of the committee members that wrote the report. First, we have Stuart Altman, who is chair of the committee and the Sol C. Shanken Professor of National Health Policy at the Heller Graduate School of Social Policy at Brandeis University. Also joining is Paula Gubrud, an Associate Professor at Oregon Health and Science University School of Nursing. Joining us as well is Robert Phillips, Vice President for Research and Policy at the American Board of Family Medicine. And we also have Edward Salzberg, Director of Health Workforce Studies at George Washington University's Health Workforce Institute and School of Nursing. In addition, we also have Adrian Stith-Butler, who is a Study Director for this report, and Lauren Shern, Program Officer for the report. We'll start off with the committee members summarizing the report, and then we'll open it up to any questions you may have. Please note that this briefing is scheduled to last for 1 hour unless we run out of questions beforehand. And with that, I will turn it over to Dr. Altman.
Hi, this is Stuart Altman, and I'm pleased to present the overall recommendations of our committee. We were very fortunate to put together a committee which included sort of practicing nurses, physicians, a number of researchers who are very knowledgeable about data in the nursing area. And I'm pleased to sort of act as the chair today and during the report. I just want to put in some context what we're talking about. So as I think all of you know, in 2010, the Institute of Medicine introduced and put out its report on the future of nursing and made a number of very important and strategic recommendations with respect to how nurses should be educated, the role they should play in our healthcare system, how they can sort of develop in their own lifetime in terms of education. Following that report, a number of organizations in the United States took the recommendations very seriously and have been working very hard to implement these recommendations, most notably the Robert Wood Johnson Foundation and its campaign for the future of nursing. And in 2015, the Robert Wood Johnson Foundation asked the Institute of Medicine to review the progress over the past 5 years. I want to make it clear that the committee clearly took its mandate very seriously. We looked at all information that we could gather reasonably quickly. We brought in our own expertise, having been very much involved in different aspects of the healthcare system. What we did not do, and I want to make it very clear, we did not focus on re-examining the recommendations of the 2010 report. We were not able to develop a whole new data system, so we were obligated to use what information was available and to try to assess the implication. So with that said, the committee was very impressed with, first of all, the report in 2010. That report was done in the context of a changing healthcare delivery system, and in a very positive way took the wave that was moving through our healthcare system and expanded it both in terms of the role of nursing, how the healthcare system is changing, the new delivery systems, the new financing systems, and again, the role of nursing in that activity. I'm going to go through the slides that are listed, and as you can see on the top, the number of slides, so that I'm just talking about what is on the third slide, which talks about the context. And as you can see, I won't read these slides, but I will summarize them fairly quickly, and you will get them and have them. So listed on slide 4 is the charge to the committee, and which continues on slide 5 and 6. Now, in putting our activities in context, we had 4 in-person meetings, and we conducted 3 public workshops. Many of you, I'm sure, were at those workshops. It included a whole variety of individuals and groups who are very involved in our healthcare system and in nursing throughout. We focused on what literature was out there, and again, the kind of data that we could get access to. If we move forward into the slides, having a little problem here getting these things to work. On slide 8, we focused on how we've operated during this thing and during the review. Again, as I indicated, I want to emphasize this. The committee did not attribute progress or lack of progress with respect to other aspects of the system. We did not re-examine the merits of the future of nursing recommendation. Nor could we really focus on the ultimate outcomes of changes in the nursing profession or the health system on outcomes when it comes to that aspects of the world. So let me go through the major recommendations. And we're going to focus on the major areas of scope of practice of nursing, how nurses are educated, their collaboration with other members of the health profession, and their role in leadership. Important area with respect to the diversity of the nursing workforce, and finally, the kind of information that is available for us to assess. So as we move forward in this thing, I'm going to just turn to slide 10, which indicates our conclusions and recommendations. So let me first focus on the issue of barriers to practice and care, which is on slide 11. This, no question about it, is an area of some concern and disagreement within the broader healthcare community. But as was indicated in the 2010 report, the healthcare system and healthcare services in America would be much better served in the quality of care if nurses, particularly nurses with advanced training, were allowed to practice up to their educational competence. And the recommendation was to move forward and expand scope of practice in a number of areas. As we reviewed what is going on in the country, there is no question that a number of states have moved aggressively to allow nurses to become much more educated and work in terms of moving forward. Our recommendation is to build on the common ground that has been established on scope of practice with respect to allowing nurses to use their competence to the full extent. Now, with that said, I think it's also fair to say that the healthcare delivery system is changing, and which will make this scope of practice recommendation even more important. We are moving increasingly towards team-based care, where a variety of professionals are needed in order to provide that care. In the context of team-based care, having nurses as key members and as members at the highest levels makes all kind of sense. So we think that going forward, there ought to be more willingness for different professions within the field of healthcare to accept this recommendation. And we hope that nurses, along with physicians and others, will work to generate a higher level healthcare system. Now, when it comes to education of nurses, as we turn to slide 12, it is clear that with the changing healthcare delivery system and the changing role for nurses in that system, advanced education becomes more and more important. And therefore, the recommendation of the 2010 report to move towards 80% of future nurses being trained at the baccalaureate makes all kind of sense. And so we accepted that and recognized that we needed to move forward on that. We also knew that in doing that, there are other aspects of the educational system and the delivery system that needed to be looked at. We also recognized that we needed to look harder at the area of residency, or what we call transition to practice residency, and I'll talk more about that and as we move forward. So on slide 13, our second recommendation is that what's very important is that not only that we expand, and we did note a number of new baccalaureate-trained programs. It has been quite impressive in terms of the new programs. But we also recognize that our associate degree programs and what's left, the few diploma programs, are going to continue to function and are very important. And therefore, in recommendation 2, we noted and emphasized the need for continued pathways towards increasing the percentage of nurses with baccalaureate degrees. In other words, both allowing more to go into the baccalaureate program in the beginning, but also to develop and expand what is already occurring in terms of associate degree nurses being allowed either while they are in their educational training or while they're working to attain a baccalaureate degree. Recommendation 3 focuses on the need to create and fund transition to practice residency programs. Again, as we reviewed the literature, there is growing evidence that these residency programs both allow the nurses sort of the ability to sort of transition into the healthcare workforce, and probably more importantly, the preliminary evidence is that it improves the quality of care as they practice their profession. As we move towards to slide 14, we emphasize here the need for those nurses that want to pursue a advanced degree, particularly a PhD or doctorate degree, to be sort of encouraged to do that, and to make sure that there is adequate capacity in the education system. This advanced training in research and quality can be done in schools of nursing, schools of public health, schools of public policy. It is important not only for nurses to receive this training, but for others in the healthcare field to recognize the importance of nursing and to sort of be educated in a common environment. So we encourage this type of advanced education to go on in all aspects of our educational system. On slide 15, we focus on the issue of interprofessional and lifetime learning. Again, our hope here is that nurses, given the importance of the changing complexity of our healthcare system, it's important that all professionals in our healthcare field continue to educate themselves. This is a fast-moving field, and much as the education system in day one does the best job it can, it cannot anticipate all the changes that are going to be made 5, 10, 20 years down the pike. So lifetime learning becomes extremely important. We recommend that many of the outside groups, foundations, others in the nursing field encourage and, in fact, help support lifetime learning. Now, as we move to our next area of diversity, which is on slide 16, I want to make a couple of comments. And the committee was impressed by the success that nursing has accomplished in terms of expanding the number of minorities in the field of nursing. Quite frankly, it's a goal that we would like to see other professions, both in the healthcare field and in others, attain. But it's not enough. The numbers, although impressive, are still substantially less than the percentage of the population that are Afro-Americans or Hispanics or others. It'd be nice to see more males, in addition, coming into the field of nursing. So diversity needs to be an important component of the campaign as it moves forward. Again, just to emphasize what I said in the beginning, but I want to make it clearer. Our role here was to help the campaign and others in this area for the next 5 years to sort of continue to push forward to sort of get the recommendations of the 2010 report accomplished. And diversity becomes very important. We were impressed by the campaign, which in the beginning, this is the Robert Wood Johnson campaign. In the beginning, diversity was sort of spread among a number of its areas of focus, but the campaign itself recognized the importance of diversity and made it a core aspect of state activities, and we were very pleased to see that. We want this to continue and believe that it will just add to the stature of nursing in general. It will help the healthcare delivery system in many ways. So in recommendation 6, which is on page 17, you see that we want to make diversity in the nursing workforce a priority as we move forward. Going again back to what I said in the beginning, the healthcare delivery system is changing. It is, again, moving towards more team-based care, the need for more interprofessional collaboration, the need for the various professions to work together. And therefore, we focused our assessment on that. Now, to do that, nurses are and need to take more leadership roles. The original recommendation in the 2010 focused on the need to see more nurses on hospital boards, and that's a very important component of our system, but it is surely not the only component. Many of our fellow committee members recognize that nurses are now playing a much more active role in government at senior positions there, working as senior executives in insurance companies, actually running hospitals as CEOs and COOs, and that this broader definition of leadership needs to be emphasized. In order for these recommendations to impact on the broader healthcare system, nurses can and should and are taking on more leadership roles in a whole variety, and the campaigns and others should monitor that progress and encourage it wherever they can. In recommendation 7, which is on page 19, slide 19, again, we, as said, emphasize efforts and opportunities for interprofessional collaboration and leadership. And we've listed that both in terms of direct activity and activity on the part of the individual nurses. What's becoming important is in redesigning our healthcare system, we need to make sure that patients are and patient care is well represented, as well as what the professions do. And in our recommendation 8, which is on slide 20, we promote, again, the involvement of nurses in the redesign of our healthcare delivery and payment system. There is need for redesign, both to improve quality and to provide a more efficient healthcare system, but it needs to be done recognizing all aspects of healthcare, and we think that nurses can and should play a more important role in these redesigns. As we think about the future of our healthcare system, it's very important that the general population understands what's going on. Every survey one reads puts the fact that the populace in general, and patients in particular, view nursing at the top of their list in terms of a profession that they have confidence in. This needs to be expanded. The general population needs to understand what is going on and that the changing role of nurses is very important. Therefore, we recommend that the Foundation and others broaden their scope in terms of educating the population, the broad population, on what is going on with respect to the changing education of nurses, their changing role, and how important that is. Much of the original emphasis, we believe, was correct in terms of getting nurses themselves conscious of what was going on, and now it's time to move forward into the broader community, and that's listed on slide 21. So finally, we turn to the importance of information. Information, and both for the profession itself and information for the policymakers in the broader healthcare field. And while there's been progress in terms of expansion of some data, there are places where we seem to be lagging in terms of developing data sets that have been in the past very useful. So we have a whole section that focuses on the need for re-emphasizing the importance of information through new data sources. In recommendation 10, which is on slide 23, again, we emphasize the importance of improving workforce data collection. And in doing that, we, again, focus on the need for collaboration among a variety of organizations in terms of the collection and analysis of this workforce data. And given the fact that we've had an absence of the National Healthcare Workforce Commission data campaign, and we emphasize, A, the need to reinstate it, but also to make sure that if that doesn't happen, we have alternatives. So that is our overall 10 recommendations. Again, the Commission was impressed with what has gone on so far in the first 5 years after the publication of the 2010 Institute of Medicine, but more can, and I think, and we all think, will be done, and we hope that our recommendations will be of some help in the campaign and others who are interested in moving forward these recommendations. So with that, I will stop and turn it over to questions and to comments by my fellow commissioners.
Thank you, Dr. Altman. I'd like to tell folks the URL I gave earlier seems to not be working very well. So if you want to get a copy of the PDF of the report as well as the PDF of the slides, if you go to www.iom.edu, if you scroll about the middle of the page, you'll see most recent reports, and the nursing report is the first report on there. Click on that link, and it'll take you to our report page, which has the report and the slides. Again, that's www.iom.edu. Scroll down to most recent reports and click on the report link, and it'll take you to the proper page. And I do apologize for that. So at this time, we will be taking questions of the committee. And if you have a question, please type it into the Q&A box in the lower right-hand corner of the screen. I will be reading the questions, so if you are a reporter or if you're with us or with a certain organization, if you can please identify your organization in the Q&A box when asking your question. Okay, so our first question is there a shortage in the number of nursing educators? If there is there anything done to promote the number of educators?
What's interesting, the answer is yes, there is a shortage. But what's interesting is that it's not only in the number, but it's also in the willingness of a number of our educational institutions to expand the number of nurses within their program. Even though we know we have a shortage, and that there are many more individuals that want to be trained as nurses. When we looked at the data, it does not look like a number of the colleges say they have a shortage. Yet, when you look behind the numbers, the shortage is much more serious. So I think it's a two-part attack on this. One is that more of our institutions of higher learning need to recognize the importance of expanding the number of nurses or individuals who are educators in the field of nursing. And two, we need to provide funding for them. I'm going to ask some of our other commissioners if they want to. I know some of them have been very much involved in that. Paula or others, if you want to jump in.
Sure. So yes, there's a bit of a shortage now, and a predicted shortage given the average age of the nursing faculty. When you look at the spread across ages, we have a large number of faculty that are in their late 50s to mid-60s, and then the number of faculty behind that don't back up what's going to retire. So as Stuart said, we need to be proactive about that. We identified that one of the issues is funding for advanced education that's required in most states to become a nurse educator. So there's work to be done there.
This is Ed Salzberg, and I'd like to just jump in. It is important to note that there has been a very significant increase in nursing school enrollment and graduations that I think has really been extremely helpful. It's also worth noting that since the Future of Nursing report, there's been a significant increase in the number of RN to BSN programs, and enrollment there and graduations there is up significantly. So we are very encouraged by the continued growth in the number of nursing graduates.
Okay, our next question. Many of the recommendations in the report would suggest tracking metrics. Are there data slides within the report?
So I have before me the copy of the report and where we were able to find data, and I'm going to turn this over to Ed in a minute. We tried to incorporate as much information as we could find. I think it's fair to say that we could benefit from additional information on this subject, but let me turn it over to Ed because he's our data maven.
Thank you, Stuart. There are some, the report includes some key data in terms of trends over the last several years that hopefully the community will find to be helpful. We also identify, in some cases, some very specific data elements that we recommend be tracked and included into the dashboard that the campaign has established. So there are some specific recommendations around data in the report.
Okay. Our next question, can you please give some specific examples of data that supports the conclusion that the campaign has made significant progress toward implementing the recommendations of the Future Nursing Report and has met or exceeded expectations in many areas?
Well, again, if you go, there were a significant number of recommendations in the 2010 report, both the major areas and in a number of the sub. Where we could find specific information, we listed it in the report. We were as diligent as we could. I think the question is right on. Where there was good information, we made it available. Where there was some information, we said, okay, this is what's available. So you'd have to go through the report recommendation by recommendation, but we tried wherever we could to list the kind of information that's available. And for those of you who are interested, there's a very extensive bibliography in each of the chapters that lists the kind of information we were able to find. I don't know if others want to, Ed or others want to say any more.
I would jump in on 2 points. One is, and the report does document this, there's been steady growth in the expansion of the scope of practice, and I think the recognition of the importance of expanding scope of practice of nurses, and the campaign has really been, I think, very influential in that area. I mentioned before the significant growth in the number of RN to BSN programs. This is an area where I think the Future of Nursing report had a significant direct impact with providers across the nation and nurses across the nation hearing the call for the growth in the percent of baccalaureate prepared nurses. And again, shortly after 2010, you see a significant increase in the number of RN to BSN graduates. So I think that's a pretty direct impact of the recommendations of the Future of Nursing report.
Okay, our next question, a few folks asked, what are the next steps that are going to follow the release of the report?
So the report will, of course, be available, and we obviously encourage all who are interested to get copies of it. This was funded and asked for by the Robert Wood Johnson Foundation. They are planning a major focus on the recommendations of the report. There is a big meeting scheduled for December 9th by the foundation talking about how they're going to be moving forward in the campaign. We've had discussions. We had a preliminary discussion with the foundation staff, and they were quite pleased about the overarching recommendations of the committee and plan to use the recommendations in changing or expanding the focus of their campaign. We anticipate that others who are involved also in trying to promote the recommendations to make use of the information. What has been impressive to me, having been part of the Institute of Medicine for a very long time, is the amount of effort on the part of other organizations to see the recommendations of both the 2010 report and now the 2015 report implemented. So this is not just a set of reports that have been put on the shelf.
Thank you. Our next question comes from the Massachusetts Coalition of Nurse Practitioners. They ask, was the committee able to identify a list of barriers in APRN practice per recommendation 1 that have been eliminated since 2010?
So as you all know, this is a state-by-state issue. Scope of practice is a state issue. I should point out that at the federal level, the Center for Medicare and Medicaid Studies, CMS, has been quite aggressive in expanding their payment structure and their codes to allow nurses with advanced training to provide care and to be paid for it. You have the Justice Department and the Federal Trade Commission who have issued reports indicating that they consider expanding scope of practice very important in terms of making our healthcare system more competitive, more available. And then you have to go state by state, and each state is sort of taking on different aspects of it. Some have totally removed any barriers, any restrictions on scope of practice. Others have expanded scope of practice but kept some barriers in. So I think you have to look state by state. And for those of you in Massachusetts, you know that there are some restrictions in Massachusetts that still exist. Matter of fact, Massachusetts is the only New England state that has not moved as aggressively forward as the recommendations would suggest. I don't know if other members of the... Bob, do you want to focus a little on both the concerns and the progress that's being made, particularly with respect to the physician community?
Sure. Thanks, Stuart. This is Bob Phillips. A couple of things that have, not necessarily barriers, but contextual issues that have changed in the last 5 years that we thought were important. One of them is an increasing focus on the triple aim for health care and value-based care. So better health care, and smarter spending has really refocused on the need for all members of the team to be practicing at the top of their training, experience, and license. So we think that context may be removing some of the parochial interests and professional infighting with the recognition that everyone needs to be working there. And in fact, there's this notion of the quadruple aim, with provider satisfaction being the fourth one, and evidence from Krasinski and Tom Bodenheimer is increasing that highly effective practices are also have a lot of joy in them, and that provider satisfaction is tied to everyone working at the top of their license. So we think that context change is pretty important to removing some of the professional infighting about this.
Thank you. Our next question, they ask, public health nurses were not mentioned in any of the recommendations. Did the committee examine the PHN workforce and their continuing decline? Did you evaluate the decline in the number of PHN advanced degree programs, including master's and doctoral level?
The answer is that it was not a priority item within the 2010 report, and therefore did not get much discussion within our committee. I think the question is a good one. I am familiar with the work done by public health nurses, and the answer, I think the fair answer would be that we did not focus on that area. very much. It did come up here and there, and as you have more baccalaureate-trained nurses, the hope is that this would expand, but we did not focus our efforts directly on that issue.
Our next question asks, have you seen a shortage in entry-level staff nursing since the report calls for entry-level to be baccalaureate degrees?
A shortage in terms of, we've seen, as Ed Salzberg indicated, we've seen a substantial increase in the number of nurses coming online. We've seen a substantial increase in the number of coming online with baccalaureate degrees. We've seen an expansion on the part of employers interested in having their nursing workforce be all baccalaureate trained. So I'm not exactly sure what the questioner wanted an answer to, but for the most part, it appears that the flow of nurses into the field has been adequate for an expanding demand. We are concerned about the future, particularly as Paula indicated, with the expected substantial retirement of older nurses with more experience. Nursing has proven to be a very valuable profession to many people, and we anticipate that it will continue to be. I think it's fair to say that, as one of the other questioners did, our main concern was on whether the training systems will be insufficient in number and adequate to take on the expected continued growth in the number of individuals wanting to be nurses.
Stuart, I would just add that, we did see that there's been a continued, well, there has been a very significant increase in overall growth, that the BSN growth has been stronger and more significant, and we think that that may reflect the committee's recommendations. The growth of associate degree nurses has continued, although more recently it looks like it may have leveled off. The committee really felt that both pathways were extremely important, and that the associate degree pathway seemed to be an important pathway for many individuals who don't yet have access to direct entry to a baccalaureate degree. We were pleased to see the growth in RN to BSN pathway, because we think that many of those that can access nursing through the associate degree will have, or should have, a greater opportunity to obtain their BSN once they've become a registered nurse.
Thanks. Our next question is, many nurses are pursuing DNP degrees as these are less intensive and require less hours to complete. I believe recommendations need to also focus on a need to increase number of PhD-prepared nurses.
That's exactly true, and it is an important area in the report itself. There was a number of discussions about that while overall doctorates have grown, the number in the PhD level has not grown nearly as fast. And so the questioner is absolutely correct. We need both kinds of trainings to expand. Again, I would emphasize that for doctorate-trained nurses or individuals that have the kind of research training that comes with a PhD, they could come from other types of training programs other than nursing schools, schools of public health, schools of in public policy, and so on. So the questioner is correct. We need to emphasize more about the PhD training as well as the doctorate.
The next question is, what can be done? Oh, sure.
Thank you.
Hello?
Hello?
Did you want to follow up?
No, go ahead.
Okay. What can be done in states who continue to be restrictive with advanced practice nurses and find physicians lobbying against any legislation to improvement? Could there be a national move to increase APRN ability to practice to education and ability?
Well, again, as I said, this is I think we did talk about that. There is a combination. This is a state responsibility, but having this national movement and having the number of states moving in that direction over time, we believe will have an impact on those states that have been reluctant to change. The other aspect, I think one needs to focus on what Bob Phillips talked about, which is there needs to, with the changing delivery system and the changing and the fact that more and more physicians recognize the importance of what nurses can contribute, there needs to be a bit of a change in the rhetoric. Bob, you may want to sort of expand on what you just said so that we can bring a kind of a common sense of the need for this kinds of change. Bob, you want to focus on that a little more?
Sure. Thanks, Stuart. I think that we talk in the report about the opportunity for expanding the coalition and the focus of the campaign to include other stakeholders, but particularly physicians, around this common need, this common ground to be able to do primary care particularly more effectively. That really means everyone needs to be operating at the top of their license. So we're hopeful that that context gives some new common ground to talk about what does that mean and what do we need nurses to be able to do in particular. What are the barriers to their being able to function in this more effective system? And Stuart, I wanted to point out too, we also mentioned that there was new data, new evidence about the fact that while nurse practitioners are playing a very important role in primary care, about half of them are in other specialty services too, which means that the context needs to be expanded to talk about what does their scope of practice mean and role in practice mean in subspecialty care as well as primary care. So I think that also helps open the door to a broader need than just about nursing scope of practice expansion, but about expansion for everyone and what the barriers are. And I don't mean that to take away the focus on nurses and nurse practitioners, but just to mean that there's a broader context now and a broader opportunity.
Paula, do you want to comment at all about, how nurses themselves look at this issue?
Sure. Well, overall, I think nurses are excited about practicing at their scope of practice. I think from a nursing perspective, we have to stay at the table. We have to gauge our leadership and enhance our leadership at the table. We have to be persistent. And then finally, I really like what you said, Stuart, about we need to change the rhetoric. And what we need to be talking about is patient outcomes and population health, and the contribution that we each make as a member of the team, and focus on what's best for the nation's health, and continue to dialogue and move forward through persistence.
Thank you. Our next question, do you have any recommendations on what the nurse residency should look like, length, et cetera?
Thank you for that question. We did look at some depth about the nurse residency issue, and there are a couple of statements that I would make about that. First of all, there are many different models out there. Some of them are, more closer to what have traditionally been residency programs with physicians. They tend to be either academically based or flow directly from a hospital. But there are a number of others that are being done in the ambulatory side of things and differently. So when that section in the report, the first thing that we focus on is the need for better review of the different models to determine which ones seem to work better. I think it's fair to say that there has not been a careful evaluation of which type of model works better. And given that the nursing and nurses are going to be in a variety of different delivery systems, there is no one model. Again, for many, the needs are going to be more on the ambulatory basis rather than hospital-based care. There are more residency programs out there that sort of build off the hospital model, and again, the ones that are out there seems to be working, but the feel is that as we move forward in the advanced nurse practitioners to be more involved in the ambulatory is going to be more and more important. So we did devote attention to it. We provided what literature we could find on that, and again, I would emphasize that you go to the report and review the literature that we did find. But it's a good question, and a lot more work needs to be done. The residency area is, I would say, just in its infancy. The percentage of nurses that go through that program is quite small relative to what we perceive to be the need. Paula, do you particularly want to focus any more on the residents?
Sure. We do have some evidence of some substantial programs that make a difference in acute care. But as the nursing role is changing and more nurses are being hired right out of school, I'm not talking about pre-licensure or undergraduate now, we need residency programs that focus on caring for patients in other settings, particularly as nurses assume more responsibility for coordinated care. We need transition programs to assist with, to help them develop that unique skill set that's kind of emerging. So there's a lot of opportunity for us to study what is happening and to develop new programs to meet the emerging needs in this new healthcare system.
Thanks. Our next question asks, can you expand on some examples of workforce data gaps that are present? For example, does tracking of patterns of practice or competency patterns for specific groups of nurses align with gaps identified?
Ed, you focus most on our data issues. What do you think about that?
Yeah, the report talks about some of the progress, significant progress that has been made over the last 5 years in terms of data collection, but notes that there are still significant gaps in the data collection. We do include in the report specific recommendations for expansion of the national sample survey, which was the last national sample survey was of NPs. We call for as the original Future of Nursing report did, we call for the reinstatement of the national sample survey of registered nurses, which would give us a better information, richer information than we now have. But we also note that many nursing organizations already collect valuable nursing data, and one of the missing pieces here is an infrastructure that can weave together and synthesize the data from the multiple nursing organizations. So data is obviously collected by the NCSBN when a nurse goes to become licensed, when she becomes licensed. Data is collected by AACN from the nursing programs. The federal government collects data through a number of programs. All of these bits and pieces of data can be better integrated through a more organized system. And without the National Healthcare Workforce Commission, which we think is, while we would welcome and love to see the commission meeting, we don't expect it at this point. And so we really do think that the nursing community needs to come together and work more collaboratively within the nursing community to build better data sets and to assure coordination among the data that is collected.
Stuart, this is Bob. Would you mind if I weighed in just on one
Please.
piece here?
Sure.
So Ed Salzberg was really critical in helping us understand this landscape of nursing data. and actually digging up some new and novel sources of information about the nursing workforce. But one of the things that struck me, and we talk about this some in the report, is that most of these only categorize nursing in the outpatient setting. They don't really give us a sense of nursing in primary care versus nursing in other outpatient settings. And given where healthcare is going, that is so critical, I just wanted to highlight that because it was amazingly opaque, understanding how the outpatient nursing workforce was distributed.
The other area that has not been mentioned is the area of long-term care. And with the aging of our population, the long-term care, both in the institutions and in the home, is going to be an increasingly important need for the population. And nursing is, but can and needs to play even a more active role in the long-term care arena. So we need more information about how that part of the delivery system is making use of nurses and where this is the area where there is and will continue to be critical shortages.
Okay, our next question is, most of the conversation on scope of practice has focused on APRNs. What progress did the committee find with regard to addressing scope of practice issues for direct care nurses or non-APRNs?
I don't know. So most, as the question pointed out, most of the issues dealing with scope of practice has been with advanced nurse practitioners and their role as independent practitioners. And I think what we emphasize in the report is that that's important, but with the changing structure of the delivery system, it's going to be less important going forward because fewer professionals, whether they're nurses or physicians, are going to be practicing independently. When you get to the broad area of nursing in general, this issue of scope of practice from the perception we had is not as contentious. Nurses play a vital role, have played a vital role as members of teams, both in the inpatient and outpatient. So we didn't see it as much, but maybe my other fellow commissioners, Paula, or others would want to jump in.
So we did not examine the scope of practice of the non-APN nurse in the same way. We certainly addressed it. But as you read the report, our premise is that everyone needs to be practicing at the top of their scope. So that would mean that would be an ongoing conversation that needs to continue in each state in collaboration with, regulation through boards of nursing.
Okay, we have time for one more question. We're at the top of the hour. This last question asks, lack of diversity has been discussed for decades, specifically at the RN level and above. Did the committee know any significant increase in this area?
I'm sorry, in terms of diversity?
Go ahead.
In terms of diversity?
Yes, I think they're specifically looking at, what changes have you seen in diversity?
So again, we were really encouraged to see that the number of African American, Black, and Hispanic Latino nurses coming out of the educational pipeline has increased significantly over the past decade. So there's been an overall growth, and so the percentage growth has not been as impressive as the numerical growth, but the numerical growth it really is impressive, really doubling in some cases of the number, for example, of Hispanic nurses. So I think there's been progress, but I think as Stuart said, we really can't rest. Far more work needs to be done, and the report includes some very specific recommendations around data collection and developing workforce plans and convening a group to identify best practices to make sure that the efforts around increasing diversity increase and that it remains a priority for the future.
Okay, with that concludes today's webinar. Thank you everyone for joining. And just to let you know, that link that is being shown, the nes.edu/FON 5 years, is now working, and you can get today's slides as well as download the report on that link. And hopefully on Monday, we are going to be posting this WebEx on there, so you will be able to view the WebEx as well on Monday. Thank you, everyone.